We are sitting down with the state health department to talk numbers, to talk reasoning, and also some brand new information about the virus. So joining us is epidemiologist Lawrence Burnstead. Thank you so much for being with us here.
Sure.
And you know, for anybody who has our KOCO mobile news app at home, we just got a push alert. 4 more deaths just this week alone, bringing that number to 28.
Right.
And this has happened in a pretty short period of time too.
Well, correct, but this is actually around that period of time where we see our most intense level of transmission in Oklahoma and in general in the U.S. Even though the flu season goes from October through April, we normally see most of our activity within just a couple of months, January and February. So to see several deaths occurring each week that are reported, this is something that has happened in previous seasons. You know, as far as how intense this season is, it's kind of in line with several other seasons in the last several years, at least since the time that we've been counting these numbers in the past 8 years.
So the number 28, that doesn't surprise you at all?
Not necessarily. It's very unfortunate, of course, but it's not necessarily our highest that we've seen in a typical season. Mm-hmm. You know, we've seen more than 1,000 influenza-associated hospitalizations and several dozen influenza-associated deaths, unfortunately. You know, what's really important to know is that the occurrence of severe disease is occurring among people that are especially vulnerable, individuals that are 50 years of age and older, especially 65 years of age and older, and children that are less than 5 years of age. Those individuals should know that they are at more risk of severe disease and should take appropriate precautions.
Okay, you're just answering all the questions that I have for you this segment. But why is this the case? You know, it seems like we have been hit really hard this year. What are the factors that are causing that right now for us?
Right. Well, several factors are that you have multiple strains that are circulating, and then also you have conditions in regards to influenza vaccination, how many people might have received the flu vaccine this year. Don't have those specific numbers, but that is one of the factors. And then when you have intense level of transmission, unfortunately, you might see outbreaks in certain settings like schools, long-term care facilities. All that kind of contributes to how a season kind of plays out. Where this stands in regards to over the last 8 years that we've been tracking this information, it's kind of in line with what we see in a typical season. You know, it just may be that the last several weeks has been particularly more intense than what people might remember, but it's still what we might see in a usual season. Okay,
and you mentioned where I want to head next, school districts. You know, we have seen whole districts shut down over the course of the past week or two. McLeod, Minco, just to name a couple there. Because of the flu, hundreds of kids, hundreds of staff out with the flu, strep throat, combination of the two. Does the state health department play a role in, kind of collaborating with that school and saying, you need to shut down, you need to clean, or is that completely on school administration?
It's on school administration, but we certainly consult with them and advise them on some appropriate actions. But one of the factors that a school might consider is, do they have enough students to actually continue with class, or do they have enough staff to continue with their classroom instruction? And that may play a factor with it where they decide to close for several days. You know, of course, we provide information to the schools. We certainly follow up to see what strains are circulating by collecting specimens from students and staff if we can. What's certainly very important for parents to know, of course, is that because we have flu every year, these outbreaks can happen. Educate your children early on and keep enforcing that message of appropriate hand hygiene. You pick up germs in those environments, wash your hands often. Parents, if you recognize your child has fever, cough, sore throat, keep them at home until they are fever-free for at least 24 hours, because that will help to reduce the continued transmission in those settings.
And a lot of viewers chimed in too, saying, hey, I got the flu shot, my whole family got the flu shot this year, and now we're all, sick as dogs at home. Does the flu shot really work? A lot of them want to know.
It does work. There's a couple of things here with this factor too. One, the flu shot is not perfect. In a good year, we might see about 60% effectiveness, meaning that if you have the flu shot, you're 60% less likely to experience severe symptoms that require a doctor's visit. Secondly, it may be another virus that's causing your illness. And oftentimes if we have a fever, cough, sore throat, runny nose, we might attribute it to the flu, but maybe it's one of the many other viruses that are circulating this time of year and not actually due to the flu virus itself. You may not know that unless you go to a doctor and get diagnosed. So those factors are why there's maybe a misunderstanding. The flu vaccine is effective, it's safe, we certainly encourage it, but it's not the only method to protect yourself, of course, with hand hygiene, appropriate cough etiquette. And if you're sick, stay at home when you're sick, from school, from work, from daycare. That way you limit transmission of those germs to others in those group settings.
Yeah, because that virus just spreads rapidly, we know.